words. He got me choked up. I don't want to get choked up for this, but you know, I'm in the midst of my peers, and I need to let you know that. I want to ask first how many program directors and administrators are in this audience today. I have a few hands. Okay, so I'm going to ask you to bring this message back to your programs, and if anybody asks you who told you these things, you tell them Sade Ali told you these things, and they can call me if they wish. I want to let you know, as I came in, I was able to meet so many of my peers on the way in and get my hugs, which I always love. But I want to tell you that 22 years ago, I sat across from a psychiatrist. I was 22 years in recovery at that time, and that was in 1992. So you do the math. From a drug challenge. And I still wasn't feeling well, and there were things that were happening to me, and I was being hospitalized. And after one of my hospital visits, I had to visit with the psychiatrist, and it was in Bridgeport, Connecticut, and unbelievably, because of course now there's many more psychiatric practices, there was only one, so you didn't have a whole lot of choice around psychiatrists. And so I sat across from this doctor at his desk, and I noticed the timer on his desk. And you know, those of us who are in recovery, we are the most perceptive, the most observant people you will ever meet. And I noticed that timer, and the doctor was looking at my record from the hospitalization I had recently, and he said to me, "You are bipolar." Wow. Not you have a bipolar challenge, you are bipolar. He never told me what that meant. He actually, it felt like throw a prescription for lithium across his desk at me with a 6-page list of contraindications. What I shouldn't do. I shouldn't be in the sun, and I shouldn't take this, and I shouldn't do that. And it scared me to death. He never asked me who I was. He never asked me about my spirituality. He never asked me, how do you heal? He never asked me anything like that. I was bipolar. I worked in the field. I got into the field in early recovery from my drug challenge. Got right into the field. There were others who were working in the field who also had mental health challenges. Do you think we talked? No. Why? Because the oppression was so great that it was more socially acceptable for me to tell people that I used to put a needle in my arm than it was for me to tell them that I was bipolar. And so I hid. And I went into the closet with it. And I never shared it at all. Until I came to the work for the state of Connecticut, where I was hired because of my lived experience. And Michael Brody from Mental Health Association asked me what at that time was an illegal question. He said to me, "Are you in recovery?" I said, "Yes, from both. A mental health challenge and a drug use challenge." He said, "You are hired." I said, "For what?" He said, "You are hired as the Regional Director of Consumer Affairs for the state of Connecticut." Great big huge title, very little money, you know. I had no peers in the state. I was the only one in the entire state, but I worked in Region 1, which is Bridgeport to the New York border. If anybody knows, Fairfield County is the most expensive county to live in the U.S. People think it's Orange County, California. It's really Fairfield County, Connecticut. You've got the highest rate of poverty and the highest rate of wealth. So you've got Stanford and Greenwich and all of those cities or towns going to the New York border. Then you got Bridgeport. My office was in Bridgeport. But I also had, because I was responsible for the entire region, I also worked in Stanford where the Du Bois Center was. And those of you who may have worked in the field for a while know that the Du Bois Center is historic. And then while I was working for the state of Connecticut, I started to be able to come out about my challenge, about the challenge I was living with. And it became okay, and the stigma started to get reduced. It's not gone. You know it's not gone. It's still not socially acceptable to say that you are living with what is known as a severe mental illness. I don't call it a mental illness. You will, those of you who know me know that the department has called me the transformation language police. There's certain words you cannot say in front of me. You cannot say addict, alcoholic, schizophrenic, bipolar. You can't say patient, client, consumer, anything that destroys the relationship between you and somebody else. We call people individuals. I'm not even a person in recovery. I'm a person with lived experience. Write it down. Take it back. Don't allow it in front of you. Because every time we use stigmatizing words to define people, we dehumanize them. And our fields, mental health and alcohol and other drug treatment, have done that for years, forever. That's what we're taught in school. My degrees are in psychology. I was taught how to diagnose people. How dehumanizing. And so now, I ask, what is your challenge and what do you think can heal it? Not what is your problem, but what is your challenge? I'm going to tell you some stories today because I'm a storyteller. And I want especially the people who are directing programs and are responsible for programs that are supposed to provide health and wellness to people to listen well. And I want the rest of you to know that these stories I'm telling you are true. They happened to me. I've been doing this work for 43 years. I've seen it change. So I want to start, and some of you have heard these stories, and some of you have heard these stories multiple times. But that's okay, because there are enough people here who have never heard these stories. And I want to start with a story of a man. And this speaks to rap. And I mean, before I go into my stories, I want to thank Matt Federici and the Copeland Center for this honor, because I really want to thank you. Thank you. I've been following rap since its creation. They do some great things up there in Vermont. One of them is Goddard College, and Goddard College is in Plainfield, and I graduated with my bachelor's and my master's from Goddard College, so I know there's a lot of innovation going on up there, a lot of outside-the-box free thinking, and I'm definitely an outside-the-box kind of girl. But I want to tell you about this young man that I worked with in a program up in Sandy Hook. Now, Sandy Hook, for those of you who don't know, is very European-American middle class. Very much so. And there was a program up there called Cornerstone of Eagle Hill. Residential program with a freestanding detox that was medically managed by nurses and doctors. It was a great facility. 5-star chef. I think I gained 40 pounds working up there. All of the clinicians were advanced degreed. We all were certified to do the work. And I got a chart one day. I was a clinician. I was a senior clinician. And I got a chart one day into the counselor's building. We even had our own building. of a young man who was coming out of detox, 5-day detox. And I opened the chart and it said under the presenting problem, alcoholism. Well, this was 1982, and I said to the young man as he walked in my office, what is your challenge and what do you think can heal it? That wasn't on the form. It wasn't on the form. I kind of made up my own forms as I went along. I knew I had to fill in the answers to the questions, but I did it my way. The young man said to me, my challenge is, I've lost contact with my spirit animals. And I said to him, what does that mean to you? He said, well, I'm Native and we all have guardians in the form of animals who keep us on our path. And because of my behavior, I've lost contact with mine. And I said to him, well, how do you regain contact? And he said to me, well, you can't do it, and I can't do it, but there's an elder in our community who can. And I said to him, can I call the elder? Now, for those of you working in agencies and you have your administrator sitting next to you, tell them to close their ears, because I'll always believe that it's a lot easier to ask for forgiveness than it is for permission. So nobody knew that I was doing this. And I said to the young man, would you let me call your elder to bring him up here to help us? That's not in a book, ladies and gentlemen. You're not going to find that in a book. And when I work with clinicians and administrators, I say to them, you don't need to throw the book away, but close it and put it on the shelf sometime. And so he looked at me, this young man, and because this wasn't his first treatment, I was going to say his first rodeo, because I spent some time in Texas. And that's what they say, this ain't my first rodeo. This wasn't his first time in treatment. And he looked at me and he said, yes, you can. And I asked him, how do I address your elder? Because I want to be appropriate. And we called him. Sitting next to me, not on the other side of the desk. And you know what it feels like to sit on the other side of the desk, right? Doesn't feel so good. I always push my desk up against the wall when I move into a new office. Or have people sit at my table so we're all sitting together. But the young man was sitting next to me and he gave me the number and I called the elder. And I told him who I was and who I had sitting next to me. And I said, will you come and help us? And he said to me, is the facility really called Eagle Hill? And I said, yes, because in January and February, the eagles really did come to feed at the Stevenson Dam. And because the fish would rise because of the water temperature. And they would see them easily. And I said, yes, it really is Eagle Hill, and it was in January, and the eagles were flying overhead, and he said, I'll come. That afternoon, we had our treatment team meeting. Now, here's another thing. Take it back to your agency. You should not be discussing people without them sitting next to you. Nothing about us, what? Without us. If you're discussing somebody, they better be sitting there. What are you saying that they can't hear? Well, in 1982, we didn't do that. So I presented this young man, and I told the team what I was going to do. And I was on one end of the table, and my clinical director was on the other, and my colleagues were on either side. And when I told them, they started to laugh. And I don't mean smile, I meant laugh. They were laughing at me. Like, this woman really needs to take her medication. That's why I didn't tell them. But I know that that's what they would think. What is wrong with her? But the clinical director at the other end of the table was smiling. He thought it was the best thing since sliced bread. I had my release of information. I know how to do that. I know 42 CFR Part 2. I was there when that was created in 1977. So the day of the ceremony came, and all of a sudden all of my colleagues wanted to be part of it. And the elder said, oh no, only her. And I got a chance to witness this beautiful ceremony that you reunited this young man with his spirit animals. Now, at the very end, I told him I'm Native as well. Back then, you couldn't tell who you were. You couldn't share anything about you. Thank goodness that's over. But this beautiful ceremony united this young man with something that was very important to him. That was how he healed. And if we had rap back then, I bet you that would have been on it. I've seen clinicians and program administrators and programs in general say, oh no, we're not doing anything like that. That's not in the books. Thank goodness for rap. Because now people can actually put their healing ways on paper and say, this is what you need to do. This is what my family and friends need to do, and this is how I heal. Thank goodness. I was involved in the closing of Fairfield Hills Hospital. Any people from Connecticut here? Oh, okay, Connecticut in the house. So y'all know Fairfield Hills. I had a caseload, which I don't use that term anymore. People are cases, and we shouldn't try to manage them. Saw that T-shirt in Washington. I loved it. Put the phrase in my toolkit and use it in training like this when people are called case managers. How about system navigators or recovery facilitators or anything but that dehumanizing case? But Fairfield Hills Hospital was in the process of closing, thank goodness. That was the most depressing place I've ever been. It was horrible. I had a key to the doors. It was a skeleton key. It really was. It was a skeleton key. The ward staff wouldn't come out from behind the desk, so they gave all of the case managers keys to the door so they could open the door to the ward. We would take people out in pairs. And at Fairfield Hills, you know, there was, in all of Fairfield Hills, there was a very, very, very small population of African Americans, very small. But one of the pairs we took out was this elder, whose name was Jean. I call her an elder. She was my age when we took her out of the hospital. She was 66. And Doris, who was African American. And Doris, I love Doris. Doris was, one of the ways she expressed herself was making up her face. And Doris would wear so much makeup that when she got out of my car, there was makeup everywhere. And I love Doris, but I kept a thing of cleaner to do my upholstery after Doris got out of my car. But one day, we were sitting in Doris and Jean's living room. My colleague and I, we used to work in pairs, and we were sitting with Doris and Jean and talking to them. I think back in those days, we kind of like sat on them or stalked them. You know, we really didn't give them a chance to kind of live. We were always there. We were like friends, you know, who never went away. And we would take them out on trips and everything and, you know, just go out together and go to the beach because Bridgeport is right on the water. We'd go down to Seaside Park and hang out. And one day we were in the living room with Jean and Doris, and Jean said to us, Jean had been living in the hospital for 30 years. And we were in the living room and Jean said to us, you know, I used to be a Vogue model. Now, we didn't say to her, Jean, did you take your medication today? She said, and, because there was more, I was on the cover of Vogue magazine in November of 1947. And I remember that because that was the year and the month I was born. And we didn't say to her, Jean, go in the kitchen and take your medication. But she added to it and she said, and some of you are old enough, I don't know, some of you are old enough to remember John F. Kennedy. John F. Kennedy was a very beloved statesman. Very, very beloved. He was a good president. He had some faults, like they all do. But he was, one of his major ones was that he was an extreme womanizer. He loved the ladies, and not just Marilyn Monroe. And Jean said to us, and I used to go to Broadway plays with John F. Kennedy. We did not say to her, Jean, we'll go get your medication. We're like, wow, that's interesting. You know, because some of us remember John Kennedy. In fact, John Kennedy was murdered like 2 months after I came to this country. And so that afternoon, my partner went to the library and went on microfiche and looked up the covers of Vogue magazine for 1947, and there in November was Jean. Jean had maintained her figure. She was tall and she was slim, and she still was tall and slim. Jean was someone who always had a book in one hand. She was an avid reader, and a spit cup in the other. It was pretty disgusting, but Jean knew what she was talking about. And we did not say to her, you really need to take your medication. Jean's daughter was really, really involved in her care. And one day she came to visit, and we were there. Of course we were there. We were always there. And we said to Jean's daughter, we didn't say to her, oh, your mom's telling us stories about John Kennedy. We said to her, your mom told us about the times she went to Broadway with Kennedy, and she said, oh yeah, we got pictures. She was quite a social butterfly. Believe people when they tell you who they are. We didn't take her words and turn them around into something pathological. Why? Because anything is possible. We are working, and we are some wonderful people.